know what scares me? Every single day I see folks our age popping magnesium supplements like they're candy. And look, I get it. We've all heard the amazing things about magnesium. It helps with sleep. It relaxes our muscles. It's supposed to be good for the heart. But here's what nobody's telling you. For some of us, magnesium isn't a miracle pill. It's actually doing damage, real damage. The kind that sneaks up on you quietly. And that's exactly what we need to talk about today. I'm going to share 4 warning signs that mean you should stop taking magnesium immediately. Not tomorrow, not next week, right away. Now, I want to be clear about something before we dive in. Magnesium is a wonderful mineral. Most people, especially as we get older, don't get enough of it. I'm not here to scare you away from magnesium entirely, but I am here to tell you the truth that a lot of supplement companies don't want you to know. Because if you have certain health conditions, or if you're taking specific medications, or if your kidneys aren't working like they used to, magnesium can actually become dangerous. And the tricky part? The symptoms of too much magnesium can look a lot like other problems we assume are just part of getting older. So stay with me. Grab a pen and paper if you want. Because by the end of this video, you're going to know exactly what to watch for in your own body. All right, let's start with the basics so we're all on the same page. Magnesium is what doctors call an essential mineral. That means your body absolutely needs it to function, but it can't make it on its own. You have to get it from food or supplements. Your body uses magnesium for over 300 different processes. It helps your muscles contract and relax. It keeps your heart beating in a steady rhythm. It helps your nerves send signals. It's involved in building bone. It even helps regulate your blood sugar. Pretty important stuff, right? Now here's where it gets interesting for folks our age. As we get older, a few things happen. First, our bodies don't absorb magnesium from food as efficiently as they used to. Second, many of us take medications that actually deplete magnesium from our system. Things like diuretics, proton pump inhibitors, and blood pressure medications. Third, and this is a big one, our kidneys start to slow down. Even if you've never had kidney disease, kidney function naturally decreases as we age. And guess who's in charge of getting rid of excess magnesium? That's right. Your kidneys. When we're young, they flush extra magnesium out easily. But when kidney function drops, magnesium can start to build up in the blood. This is called hypermagnesemia, and most people have never even heard of it. I want you to remember that word, hypermagnesemia. It means too much magnesium in the blood, and it can cause some serious problems that we're going to talk about today. Warning sign number 1, digestive problems that just won't go away. Now I know what you're thinking. My stomach has been acting up for years. That's just how it is now. But hear me out, because there's a specific pattern to look for. Let me paint a picture. You start taking magnesium because you read it was good for you. Maybe it's magnesium citrate, or magnesium oxide, or one of those combination supplements from the pharmacy. At first, things seem fine. Maybe you even notice you're sleeping a little better, but then something changes. You start having loose stools, maybe outright diarrhea. At first you think it's something you ate, but it keeps happening, day after day. Then comes the nausea, that queasy feeling that shows up out of nowhere. Sometimes with cramping, sometimes not. You might also notice you just don't feel hungry anymore. Food doesn't appeal to you like it used to. Here's what's happening inside your body. When magnesium levels get too high, your digestive system is often the first to react. It's like your gut is waving a red flag. The diarrhea happens because excess magnesium pulls water into your intestines. It's the same reason doctors sometimes prescribe magnesium as a laxative. But when it's happening every day because you're taking too much, that's a problem. And here's the dangerous part. Chronic diarrhea leads to dehydration. In seniors, dehydration can happen fast and it can be serious. It can cause confusion, falls, urinary tract infections, and even hospitalization. So if you've been taking magnesium and you're experiencing ongoing digestive issues, this is your body talking to you. Don't ignore it. Take this warning seriously. It could save you a lot of trouble and health complications down the road. Let's move to the next sign. Warning sign number 2, unexplained muscle weakness and crushing fatigue. This one is tricky because it's so easy to write off. We expect to have less energy as we get older. We expect our muscles to not be quite as strong, but there's a difference between normal aging and something that happens suddenly. Picture this, you've always been able to get up from your chair without much trouble, but lately you find yourself having to push off with your arms. Your legs just don't want to cooperate. Or maybe you used to take walks around the neighborhood, but now even walking to the mailbox leaves you feeling wiped out. Not out of breath, just weak, heavy. like your body is made of lead. Here's the biology of what's happening. Magnesium plays a crucial role in how your muscles function. It helps muscles relax after they contract. But when magnesium levels get too high, it starts interfering with the signals between your nerves and your muscles. Instead of helping, it actually starts to paralyze them. This is particularly dangerous because one of your most important muscles is your heart. When magnesium gets really high, it can affect your heart's ability to pump properly. This can cause low blood pressure, dizziness, and in severe cases, life-threatening heart problems. Let me share something important here. In medical settings, doctors actually use high-dose magnesium to slow down the heart in emergency situations. That tells you how powerful this mineral is. Now imagine taking supplements day after day and your kidneys can't keep up with clearing the excess. That magnesium builds up slowly, and one day you wake up and realize you can barely lift your arms. If you've noticed a sudden decline in your strength or energy levels and you've been taking magnesium supplements, please talk to your doctor. This isn't something to mess around with. Warning sign number 3, difficulty breathing or feeling short of breath. This one genuinely worries me because it can escalate fast. Remember how I said high magnesium levels can affect muscle function? Well, the muscles you use to breathe are muscles too. Your diaphragm, the muscles between your ribs. When magnesium toxicity gets severe, these respiratory muscles can start to weaken. And when that happens, you might notice you're having trouble catching your breath. Now, I want to be very careful here. There are many reasons why someone might feel short of breath. Heart problems, lung conditions, anxiety, anemia, the list goes on. But here's what to watch for specifically in relation to magnesium. First, the breathing difficulty comes on gradually, not suddenly. It gets a little worse week by week. Second, it's often accompanied by that muscle weakness we talked about. You feel weak and you're having trouble breathing. Third, you might notice it's harder to take a deep breath, like your chest muscles just aren't cooperating. Fourth, and this is important, it often happens along with feeling unusually tired and maybe a bit mentally foggy. If you're experiencing any combination of these symptoms and you've been taking magnesium supplements, please don't wait. This is the kind of thing that needs medical attention. I know going to the doctor isn't anyone's favorite activity, but a simple blood test can measure your magnesium levels. If they're too high, your doctor can help you. Usually, just stopping the supplement and staying well hydrated is enough, as long as you catch it early. But if you wait too long, you might need more intensive treatment. Your breathing is precious. Please take this warning sign seriously. Warning sign number 4, and this is the most serious. Changes in your heart rhythm. Your heart runs on electrical signals. It's like a very sophisticated electrical system that tells your heart exactly when to beat and how fast. Magnesium is part of that electrical system. In the right amounts, it helps keep your heart rhythm nice and steady. But here's the catch. When magnesium levels get too high, it throws off that electrical system. The signals get disrupted, and your heart can start doing things it shouldn't do. You might notice your heartbeat feels slower than usual. You feel heart palpitations, like your heart is skipping beats or fluttering in your chest. You get dizzy or lightheaded, especially when you stand up. In more severe cases, you might even faint. Now listen to me carefully. This is not a wait-and-see situation. This is a call your doctor today situation. Very high magnesium levels can cause what's called heart block, where the electrical signals get severely disrupted. In the worst cases, it can cause the heart to stop. I'm not saying this to frighten you. I'm saying this because I want you to understand that heart symptoms need to be taken seriously. The good news is that if caught in time, magnesium toxicity can be treated. Doctors can give you calcium intravenously to counteract the effects. They can also support your heart and help your kidneys flush out the excess. But the key is catching it in time. So please pay attention to what your heart is telling you. Now, I want to spend a minute talking about who's most at risk for magnesium toxicity, because this is important. Number 1, anyone with kidney disease or reduced kidney function. This is the biggest risk factor. Your kidneys are responsible for eliminating excess magnesium, so if they're not working well, magnesium builds up. Number 2, people taking high doses of magnesium supplements. Those high-dose supplements you can buy online or in health food stores can be dangerous if you're taking too much. Number 3, folks taking certain laxatives or antacids that contain magnesium. Many people don't realize these products contain magnesium. If you're using them regularly and taking a magnesium supplement, you could be getting way more than you think. Number 4, anyone taking medications that affect kidney function or magnesium levels. This includes some blood pressure medications, diuretics, and others. Always talk to your doctor about potential interactions. If you fall into any of these categories, please be extra cautious with magnesium supplements. And honestly, it's a good idea to have your magnesium levels checked periodically with a simple blood test. All right, let's bring this all together. Magnesium is an important mineral, and many of us truly do benefit from getting enough of it. I'm not trying to scare you away from magnesium entirely, but like anything, more isn't always better. And for some of us, magnesium supplements can cause real problems. The 4 warning signs to watch for: 1. Persistent digestive problems, especially ongoing diarrhea and nausea. 2. Unexplained muscle weakness and fatigue. 3. Difficulty breathing or shortness of breath. 4. Changes in your heart rhythm. If you're experiencing any of these symptoms, please don't just ignore them. Talk to your doctor, get your levels checked. It could make all the difference. And listen, if you found this helpful, do me a favor and share it with someone you care about. Take care of yourselves, friends, and I'll see you in the next video.